We are continuing our series on the dangers of putting off medical care during the pandemic. This morning, we're focusing in on stroke and neurological health. We are joined by Dr. Chris Burke. He is the chief of neurology at Rochester General Hospital. Dr. Burke, good morning to you.
Good morning.
This has been an ongoing conversation about a lot of people concerned during the pandemic about going to specific appointments. And we've been obviously urging people, do not put off medical care. When it comes to one's neurological health or any symptoms perhaps of a stroke, explain why that is especially critical.
Well, stroke is one of those conditions where we have a very limited time to attempt to intervene and abort the deleterious effects of that event. So stroke is one of those things. If you have symptoms, one of the major symptoms of stroke being facial weakness, arm weakness, speech difficulty. If you have one or more of those symptoms, we want you in the emergency room just as quickly as possible. We want you to call 911 and come in where we can potentially intervene on that event. Now, what we have seen, and we saw this dating back to March, it's improving a bit now, but what we saw is a very significant drop-off in the number of patients who are coming to our emergency room at RGH, which we can only attribute to the notion that people felt like, well, they were too scared of the COVID virus to come in.
Outside of a stroke, what are some of the neurological issues that people should also pay attention to and seek treatment for?
Well, certainly if a patient has some sort of traumatic head injury, somebody who is either has a fall down a set of stairs or something that alters their mental status, or a person who has some type of alteration in their mental status, confusion, a person who might have a seizure. Those are the types of things also that we shouldn't be waiting on. If we have any of those events occur, we should come to the emergency room immediately.
And we know there are people out there that, despite what they hear from health experts, are still, whether it's nervous or hesitant to go to the ER or to go see their doctor. What is your message to people at home who still may have concerns about coming in during this pandemic?
Well, I'm no different from the rest of the folks in this community. I go out and I need to shop at Wegmans, and I need to go to the mall to pick things up, and I want to get a cup of coffee here and there. The reality is when you come to our hospital, unlike those places, we test everyone who's coming into the hospital. We know who has the virus and who doesn't. And by the way, it's a very small portion of people who have it. We're very careful about protecting each other and our patients from those who have the COVID virus or might have the COVID virus. When you're out in the community doing things or out in any public region, you don't know what exactly is happening around you. In the hospital, it's a very controlled circumstance. We know what we're doing with it. It's really a very safe place to be.
Dr. Burke, great information this morning as we urge people to continue seeking that medical treatment even during this pandemic. Appreciate your time this morning.
Thank you.